It's the delivery of the healthcare services that is important and can eventually help perhaps the Amazon pharmacy sector. If these telehealth providers say, well, you need a prescription, how about I can just send it into Amazon pharmacy.
Hey gang, it's Tuesday, September 14th. Lisa and listeners, welcome to the Behind the Numbers Daily, an e-marketer podcast made possible by VTEX. I'm Marcus, and today I'm joined by one of our principal analysts covering healthcare. It's Lisa Phillips.
Hello, Marcus. Glad to be here.
Yeah, thanks for hanging out with us. So today's fact, of the first 5 presidents, 3 of them died on July 4th, on Independence Day. John Adams and Thomas Jefferson both died on July 4th, 1826. The 50th anniversary of the birth of the United States, and the country's 5th president, James Monroe, died 5 years later on July 4th, 1831.
Wow.
So of course, I couldn't leave it there to find out other facts about presidents. So that was how I spent most of yesterday. So, Andrew Johnson. Fact number 1, Andrew Johnson. He served 1865 to 69, 17th US president. He never attended school, so he taught himself how to read. Fact number 2, Ulysses S. Grant, 1869 to 1877. He was the 18th US president. The S in his name was the result of a clerical error when he was nominated to attend West Point. He tried to shake it, but he couldn't. It stuck. Number 3, Grover Cleveland, 1885 to 1889. And then another term, 1893 to 1897. So he's the 22nd and 24th US president who served 2 non-consecutive terms. He won his presidency by the most razor-thin margins. He nabbed the job with just 1,200 votes in New York by 1,200 votes. Seemed close when it was like a few 100,000. 1,200?
Yeah, really. Good thing Arizona wasn't a state then.
Yeah, no. Oh, man. Anyway, today's real topic, Amazon delivering healthcare, apparently. So, Lisa, your recent report, Amazon Delivers Healthcare, notes that America's largest online retailer, and now the largest retailer overall, after recently passing Walmart, so not just online, the largest retailer in America, is taking aim at US healthcare consumers. And some folks listening might, like I was, be thinking to themselves, say what now? Amazon healthcare, what? So let's start with what are Amazon taking aim at exactly when it comes to US healthcare consumers. You know a bunch of different initiatives that are currently, well underway. When you think of Amazon healthcare, what are they doing in this space at the moment?
They're trying to move the needle, as investment bankers would say, because they're over $1 trillion in market capitalization now. And just piddling around with, Whole Foods isn't going to do it. I mean, healthcare is a $4 trillion market in the United States, and delivering services is a big part of that. What better way than to build on what they've got already and start adding more and more healthcare services and products?
Yep. So one of the initiatives you talk about is what they're doing with Pillpack and also their very own Amazon pharmacy. So what's happening in this space?
Well, in 2018, they announced they were going to buy Pillpack. And Pillpack is a specialty online pharmacy that puts medicines, people who have to take a lot of medicines in a single day. They will package them in individual, this is what you take at 10 o'clock. This is what you take at 12. This is what you take at 2. And, they'll send you a month's supply, 24/7 service. They were licensed in 50 states, and Amazon was one of many bidders trying to get them. But the founders of Pillpack went with Amazon because they said they were really trying to lower the cost of healthcare for consumers. And they found a kindred spirit in one of the Amazon executives they were talking to. So $753 million. And that got everyone's attention immediately. Walmart, Walgreens, CVS Health stock dips. But in 3 months later, it's back up. They're all back up again. It wasn't until November 2020 that Amazon rolled out Amazon Pharmacy, which is a much broader offering with a lot more generic drugs, which are usually lower cost. And they can fill prescriptions too, because they're working with Cigna, their pharmacy benefits management company called InsiderOut.
Do you have to be a Prime member to get access to Amazon Pharmacy?
No, you can use it, but this is where Amazon's big, reason for entry is that they have 58% of the U.S. population right now has a Prime membership or is a Prime member. Or related to someone who is a Prime member, in this case in my household.
Everyone knows someone who's in Prime, yeah.
And so everybody was automatically enrolled, I'm using air quotes, enrolled in Amazon Prime RX. All of those members anyway, and they get free 2-day delivery of drugs.
Yeah, so they get this Amazon Prime RX savings benefit, and you say that they get a discount card.
Yeah.
You talk about how it's honored at 60,000 retail.
They can download it.
Okay, interesting. So yeah, honored at 60,000 retail pharmacies, CVS, Walgreens, etc. They offer savings of up to 80% off prescription medication, which doesn't seem to make any sense, actually. That's savings so high.
Well.
And then you say that Walmart's introduced their own. They went and said, oh, wait, we should be doing this. Or we're also going to do this.
They've been watching, and they have had their Walmart Plus program, I think, since last year. This June, they rolled out Walmart Plus RX. Not quite the same. You can still get things online from, for the same 2-day delivery and so on. But the one thing that sets Amazon Pharmacy apart, which they introduced earlier this year in 2021, was price transparency tool for pharmacy, Prime RX members who tell them who their insurance company is. Then they will be able to say, okay, well, here's your copay. This is what you would pay for this drug with your copay. This is what you would pay for it if you just gave us cash. Because Amazon pharmacy is really working on a cash only basis. They don't accept insurance.
Right.
And it will surprise people to realize, and this is where I think there could be a wave change coming. We can talk about this later, but people don't realize that if they pay cash, sometimes they will get a far lower price than if they use their health insurance.
That surprised me. So, you talk about price transparency being as you call it, the killer app in delivering health services. As you mentioned, Amazon's introduced this online cost comparison tool to help Prime folks out. And so you can see that side by side, how much is the out-of-pocket cash price versus how much would you have to pay, or how much would your copay be through your health insurance. And so, but it's not just Amazon. You note that Walmart and GoodRx are also noticing that transparency could be the key here.
Well, GoodRx is built. It is not a pharmacy itself. It works with a lot of pharmacy benefits management companies, and they can deliver the drugs, or they can show you prices. They can show you all kinds of discounts that you can get when you get to the pharmacy counter. Or if you join their GoodRx Gold program, you become, pay $72 a year, perhaps, I think it is, and you can get even more benefits like home delivery and things like that.
Right. Yeah, Walmart health clinics, showing out-of-pocket cash prices as well. They show them on an electronic board, so you can see right up front what you're going to be paying for different services. So as you mentioned, the goal here seems to be, a couple of things, I guess. One, if you're a Prime member, this is going to make the program even stickier. And it's going to be just one more reason to get Prime and hang around on Prime. Two, the market. The US prescription drug spending reached $370 billion in 2019. That was up 6% from 2018, citing a National Health Expenditure Data report published by the CMS. And just the market in terms of not just the dollars, but the patients. 6 out of 10 US adults have one chronic disease, heart disease, diabetes, etc., according to the CDC, and 4 out of 10 have 2 or more. Another stat, half of the US adults took at least one prescription drug in the past 30 days, 2015 to 2018 CDC. So a huge market, to say the least.
And growing.
Right. Unfortunately so. As well, the guy in charge of Amazon Pharmacy at the minute, I think he might be the founder or Randpillpack. So he was saying that they want to make the pharmacy shoppable, which is an interesting idea. And who better to do that, you can argue, online than Amazon? Yeah,
well, I actually interviewed TJ Parker, who the man you're referring to, and he actually started off as a pharmacist himself. His father was a pharmacist. And so he became a pharmacist. And realized that people couldn't afford their medications. It was hard for them to get them, hard for them to take them. I mean, as you say, with so many people taking multiple drugs each day, they get confused, they lose track of what goes when. Anyway, so he started this online pharmacy to try to address that and help with what they call medication compliance, adherence. So, yeah, he and his co-founder, Elliot Cohen, put the company up for sale quietly and were inundated with interest. And Amazon came along and they said, yeah, this is what we really want to get this out to as many people as possible. They were already an online service anyway.
Yep.
So
you had a really interesting chart in your report from Deep Intent from March of this year. How do American adults find information about prescription drugs? Number one, they speak to their medical professional, maybe unsurprisingly, but that was just 53%. In second place, very close to that, just 7 points back, was online searches for specific drugs, and then online searches for specific medical conditions, like an inch behind that. So that again suits Amazon particularly well. Let's talk about some other initiatives, Lisa. So Amazon Care, what's that?
Amazon Care is primarily a telehealth offering that they started with a company called Care Medical out there in Seattle. And they were just offering it to their Seattle-based employees. They can do all kinds of triage of, where you need to go to get care if they can't give it to you. But if you need a lab test or you really need something more, they do have professionals, maybe a nurse or someone can come to your house, a registered nurse or an APRN, or someone can come to your house and perhaps conduct some tests, do some blood work, take some blood work. They've since rolled that out to a couple of other cities, Washington, D.C. and Baltimore. And then in March, they threw it open and said, okay, any self-funded employer in the United States could sign up with us for this telehealth service. And they got one client right away. In June, one of their executives made news saying, we've got a lot more clients and we'll publish a list by the end of the summer. And that has not happened. I'm not surprised either, but they're really tapping into a market there because about 60% or 67% of U.S. employers are self-funded. They pay their employees' medical expenses themselves.
But you also write, don't look for Amazon to take over the telehealth space. Why is that?
COVID has made telehealth a commodity in a way. It's gotten to be everybody needs to have it. There are dozens of companies out there. We are actually in the process of starting a telehealth benchmark report. And we're looking at all the companies that are out there, who's bought them. And Cigna just bought MD Live. Walmart just bought MeMD. So it's become just a way to get people in the door. They are not really going to be going up against Teladoc or Amwell, which have banks and, hundreds of thousands of services and physicians and so on. I think for them, this is right now a way to help fulfill what Jeff Bezos wanted Amazon to be Earth's best employer and the healthiest company to work for and so on. So I don't see them that this is the play they want to make. It's the delivery of the healthcare services that is important and can eventually help perhaps the Amazon pharmacy sector. If these telehealth providers say, well, you need a prescription, how about I can just send it into Amazon pharmacy. If you pay $7.99, you can get it today or something. So
interesting. All right, we press pause on the conversation for a quick second as we take a word from our sponsor, Vtex. Everyone is talking about digital transformation, but what does it mean in real life? Digital Insider is a new podcast series about the digitalization of retail, where business leaders, academics, and thinkers discuss how businesses are transforming and give their perspectives, practical advice, thought process, and lessons learned. Go to digitalinsider.com to learn more or listen to it on Spotify, Apple Podcasts, or wherever you get your podcasts. All right, we are back with the conversation, talking about how Amazon is getting into healthcare. So some more initiatives, somehow crossover health clinics and neighborhood health centers. What are these?
Well, this is part of Amazon. I mean, like I said, they start with their employees. A lot of their efforts, they begin trying them out on their employees. And this is another one where they decided, okay, we're going to put physical clinics near our warehouse distribution centers in certain cities. And Crossover Health is a company that does this. That's their whole MO is they will build a physical clinic, they will staff it with doctors, and they have clients like Microsoft, Comcast, Visa, LinkedIn, and Apple. So Amazon signed up with them, and they've put in some physical clinics around these warehouses for their employees. I did joke to an investment banker that, well, gee, Amazon could take over Crossover Health. And he got back to me and said, I know the CEO of Crossover Health, and he says, we're not for sale. We're not selling to Amazon. And they're backed by a lot of private equity money, so that, yeah.
Okay. I mean, they may not buy them, but they've got... So you're basically saying these crossover health clinics at the Amazon, like the ones exclusively for Amazon employees, are called neighborhood health centers, of which there are about 20, and it seems like they're adding more as well. Mm-hmm. So just another initiative that Amazon's working on. Finally, a couple of things with regards to different devices the company has. You had a segment of your report which says, Alexa... Sorry, I shouldn't say that word. Sorry, I've done it already. I've triggered.
Listening.
We've stopped listening. You stop it, Alexa. Okay, sorry. I'll say Alexi because we had someone email in who was like, "Can you stop buying things through my device already?" So Alexi, refill my prescription was the title of this segment, and it kind of struck me. Is that where we're headed?
Oh, we're already there.
And how close? Yeah, how close are we?
Oh, we're already there. I mean, Amazon back in 2018 and 2019 got Alexa. Actually, Echo is the speaker. Alexa is the software that runs it. But people never changed that word. So that's why they refer to it as Alexa. Or very few people change the word. Anyway, asking Alexa for anything is now HIPAA compliant for many, many programs. And they went out and they teamed up with health insurance companies, health systems. This is pre-COVID that would, people could say, what was my blood sugar reading? If this is where remote patient monitoring is coming in, although as far as I know, Amazon isn't in that quite yet. But anyway, they were using this for just appointments, tell me call my doctor or whatever. None of it, but it wasn't this help I've fallen and I can't get up kind of thing. This was, those are different services. But during COVID though, Alexa, the Echo smart panels and so on, a lot of hospitals started using Echoes with Alexa to put in their COVID patients' rooms so nurses and doctors didn't have to go in there all the time. They could monitor a patient or at least talk to the patient if they could, so they got big play there.
Another use case. Yeah. 63 million Americans have Echoes. So 63 million Amazon Echo device users. That's nearly 1 in 5 Americans, which is kind of an astonishing number there. Finally, Lisa, another device, Halo. So Amazon, you write, has introduced a $100 screen-free wearable called Halo about a year ago. This device talks to users' smartphones and measures things like body composition, tone of voice to assess emotional state and track sleep and activity. When this first came out, my first thought was, this is a bridge too far. No one's really going to buy these. What are your thoughts on this device?
I agree. It's creepy. The story, I'll just say, some of the stories I've read are, about the reporters, the tech reporters that have to test this and write about it have been really creeped out about how it starts saying, "Are you sad?" Or, you get messages
I'm sad because you keep asking me that question, Halo. How do you?
It's like, and that kind of information. I mean, if it doesn't understand what you're doing or thinking or how you're expressing yourself to whom, I don't know. I don't want anything tracking my sleep. I know whether I sleep well or not. That kind of stuff. So, and then when, it's like you get the app, you open it up your camera and scan your body, and then it'll tell you what your BMI is and all kinds of things. And I think it's doing gait. It can measure your gait and movement and so on. And it's just, man, I don't want to know that much about myself.
Yeah, me neither.
If it works, it works. Use it or lose it, those kinds of things. I don't want to get too deep.
Yeah. Are you sad? Yeah, I'm talking to a wearable. What do you think? It's the world become. Lisa, you write that, so that's a bunch of the initiatives that Amazon's working on. I mean, there's so many. When I first saw the title of your report, Amazon delivering healthcare, I was like, are they? And Pillpack, Amazon Pharmacy, Amazon Care, these neighborhood health centers in conjunction with Crossover Health, Echo devices, Halo as well, a bunch of different things that's going on. And you were noting as well that there's There's some other stuff also in the works.
Oh, yeah. They have Amazon for quite some time has been working on something called Project Gesundheit, because in their back labs, they want to cure the common cold. During COVID, actually, they were providing COVID-19 tests to their workers, and they had their own lab. They built their own lab to run the lab tests. And based on that, it's been rumored that Amazon is perhaps looking at launching a line of in-home diagnostic tests along the line of STDs and a few other things.
Okay. So other stuff going on as well somehow. They're doing it all. Lisa, part of your report places a pretty sizable emphasis on delivery. How, in your opinion, can Amazon's expertise in delivery help them in healthcare?
Well, I'll tell you, in almost every earnings call, at least two analysts ask about, how are you doing with the last mile? How are you doing with the middle mile in delivery and so on? So it's a huge thing for Amazon. That's what they're based on. The thing about, with medications, you either want them, you need them right away, or like if you're in the case of a chronic condition, maybe you can order 3 months in advance and so on. But yeah, it's the delivery option that is really, in that case, it's an either or thing. And if you need them really quickly, you'll go to your neighborhood pharmacy and maybe you take your Amazon Care card with you or pharmacy card with you, but probably you don't.
Right. So faster delivery times could be the one thing that makes people say, yeah, maybe I'll give that a try. There was something I was reading maybe in the last year or two, and it kind of painted this picture of, the parent who's at home, maybe a single parent, maybe a parent who's, their spouse isn't in the home with them. Maybe they have a sick kid. Maybe they have other kids to take care of as well. And at the same time, maybe they're being expected to work from home. And this idea that, this was through drone delivery in particular, but you could order the child's medication from somewhere and have it show up like within the hour or even faster, perhaps. We were talking about drone deliveries on the Weekly Listen last week, and they were saying there were some tests from Google's Alphabet's Wing division, which in Australia is delivering things in Brisbane, in a suburb there, in less than 3 minutes. So that idea of, I really can't get out of the house, I need my kids' medication quickly, or maybe it's someone who's older, maybe it's someone who has some kind of physical disability and it's harder for them to get to the pharmacy or whatever, and so a very attractive offering for folks like that, perhaps.
Well, I'm wondering if in the U.S. is it even legal to deliver drugs via drone? I guess it would be. I mean, why not? They let the post office do it. So
yeah, but the post office, they can get through bad weather better than I imagine most drones can at the minute.
True.
But yeah, lots to work out before we start seeing them fly around the skies in the US. So Lisa, finally, so you write in 5 years, Amazon may still be just another player in healthcare services. However, that surprised me because we're used to seeing them annihilate the competition in every field that they explore. In your opinion, is Amazon taking over healthcare not a certainty?
No, I don't think so. First, they've been quick to pull the plug on things that they decide they don't want to do anymore. It could be that if they don't get enough traction with Amazon Care, their telehealth thing, they could sell it. They Crossover Health, Apple bought its clinics from Crossover Health and thought they were going to build out a big healthcare offering using their employees as guinea pigs, and that didn't go anywhere. So I will say real healthcare is capital intensive. When you're talking about hospitals, ambulatory surgery centers, medical devices and things, Amazon is not going there. They're going to light footprint, use what they've got, e-commerce, heft, a lot of Prime members, and then you know what? They could take over a small generic pharmaceutical company and then start really moving. Who knows? I mean, they have enough money to buy Pfizer, I think, at this point. Maybe not.
Wow.
But
yeah, I mean, they don't. That's the thing. They don't need to. That's that we've kind of got so used to. At least I have gotten so used to them taking over every industry that they want to play in. That you think, okay, if they don't take it over, then have they failed? No, they could still make a ton of money, and they could, as you were saying in your report, they could make Prime even stickier, which would be a huge plus for them. In your opinion, final question: what do you think Amazon's next move in this space might be? Is there something that jumps out to you in terms of they'll probably look to maybe buy this type of company, get into that type of arena, or maybe one of their existing initiatives, you just think they're going to maybe press down on the accelerator even harder?
I think, it could be the in-home diagnostics. would add that to the pharmacy offerings, and then they would be doing the lab tests and everything themselves, taking business away from Quest and LabCorp. That's where I see, it's like I got the example from several people of look at what they did with Whole Foods. Nothing. And yet, they haven't expanded Whole Foods to the entire country, but they used it to learn the business, and then they invented Amazon Go stores where you don't, no cashier, just walk in and out. So I can see them, as I said, maybe buying a drug company so they don't even have to negotiate prices with anybody and just move forward there. I don't think they're going to be employing fleets of physicians or anything like that.
Right. All right, that's what we've got time for this episode. It's time now for the post-game report, where we summarize the key takeaways from the episode in about 30 seconds or less. Lisa, we've talked about a lot. If the folks listening have to remember one or two things, what do you think they should be taking away with them?
Amazon wants to embrace you, deliver your healthcare. They want to be your doctor, or they want to fill your doctor's orders. They want to get in at the very beginning of healthcare, the patient care journey, and then they want to shunt you off into Amazon Pharmacy to buy your drugs from them.
Yeah. Well, the report's called Amazon Delivers Healthcare. The world's largest online retailer takes aim at US healthcare consumers. Came out very, very recently, so check that out. If you're a pro subscriber, emarketer.com is where you can find that. If you're not a pro subscriber, I can't help you. Sign up, then you can get it. That's all we got time for. Lisa, thank you so much for hanging out.
Oh, thank you, Marcus. Good to see you.
Absolutely. Good to see you too. Thank you to Victoria, who edits the show, and so much more. Thanks to everyone listening. We'll see you guys tomorrow for the Behind the Numbers Daily, an eMarketer podcast made possible by VTEX.